Hello, I'm Professor Mark Whiteley from the Whiteley Clinic. I'm often asked what are the commonest or what are the usual ways of treating varicose veins. And that's a very difficult question because although most people think of varicose veins as the lumpy veins on the surface, they're of course caused by an underlying problem. Usually it's by one of the long veins, called the saphenous veins, from higher up in the leg or behind the knee, but very often it's also from perforators or pelvic veins, and in most patients it's a combination of all of those. Most doctors think that varicose veins are caused mainly by veins called the saphenous veins, and they used to be stripped out, although that should never be done anymore. The research shows quite clearly, and the NICE guidelines show that stripping is not a good option, and also general anaesthetic shouldn't be used for any of these new techniques. The commonly used technique at the moment is a thing called endovenous surgery, which is often radiofrequency, although there's major advantages in fact in using endovenous laser instead. But it's quite technical as to why one is better than the other. For perforator veins, which unfortunately most doctors in the UK and around the world don't do at the moment, but it is a major cause of problems, we use the TRLOP technique, which is TRLOP, invented at the Whiteley Clinic, and that's where we weld those closed using probably endovenous laser. Again, you can use other techniques for that, but the endovenous laser is very good for that. Veins on the surface, if they're large, should be removed by phlebectomy. If they're smaller, can be removed by foam sclerotherapy. And if varicose veins are coming from pelvic veins, we use platinum coils to close the veins in the pelvis to stop the varicose veins or the venous reflux going into the legs. So there's different combinations of treatments that are needed to get the best results, and this is why we have the Whiteley Protocol that starts off with an expert scan, and then finding out each individual patient's pattern, we can then choose which combination of techniques they use to get the best long-term results with the lowest recurrence rates.